Good morning. Today we're going to be addressing the last topic of the week for the course Nursing Informatics 764. This week really addresses some of the key aspects of informatics that are central to the advanced practice nursing role. We're going to be looking at policy and ethics. I want you to have available the handout with the 17 slides for today's lecture on it as we go through this. The goals for our class this week are to analyze a case using a principled approach and establishing a plan for contributing testimony or commentary on an informatics issue that advanced practice nurses are qualified to comment on. Now, this week we're going to follow the same approach that we used in class last week. That is, we're going to have a discussion after you've looked at this preparatory video. So I hope you get a chance to look all the way through this. There'll be a case discussion, and then we'll have your questions as taken off the website. Please remember to put your questions on the website by no later than noon on Tuesday. And remember, we're trying to pump up the discussion this week. We're trying to really push hard now to get into looking at an evidence base for our comments, a principled approach to analysis. So go to slide 3. I want you to begin to think a little bit about what does it mean to act in an ethical manner. Everyone in this group, I'm sure, would say that they do act in an ethical manner and that their attempt to create a practice is really driven by wanting to behave in an ethical framework. But what does that really mean? We're going to spend some time taking that apart right now. First, on slide 4, I want you to remember that there is a legal structure around which we act ethically. The legal structure has 5 key aspects that your text identified for you, and they to me form the baseline of what is proper practice, not necessarily what is ethical practice, but proper. So first we have liability under tort law, and this is where issues related to negligence, malpractice, and product liability are addressed. Privacy and confidentiality are addressed under the HIPAA provisions, and they are a regulatory framework rather than a tort law framework. We then have intellectual property and fair use, which have both regulatory as well as legal or law-based aspects. The last 2 that are important for you to understand as an advanced practice nurse is the Graham-Leach-Bliley Act, which describes privacy related to information collected by financial institutions like banks and credit card companies, but also has some implications for patient care, and the Sarbanes-Oxley provisions. And the Sarbanes-Oxley provisions address the appropriate and ethical behavior of boards overseeing the activities of organizations, particularly addressing protection from inappropriate accounting practices. That is, and this relates to healthcare in some ways, including, for example, the ability to go after an individual for unpaid charges that are not covered by insurance. Slide 5 addresses some of the key terms we're going to be talking about today, and I want you to think about these terms as they relate to both an ethical practice as well as the basis for your public policy. First, we're going to consider the big 3: privacy, confidentiality, and security. You've been looking at these from a lot of different perspectives already, from the perspective of what does this federal and state law require, what do individuals and lay people understand, and how does an advanced practice nurse really enact health care information practices that maintain the patient's level of privacy, that keep patients' data secure, and also are provided through secure aspects of information management. Privacy is an individual's right to disclose. That's something that only the patient has say over. Confidentiality, on the other hand, is a professional relationship. That is what we promise, what we agree to give to patients. Now, I've heard some conversation throughout the class this semester that's actually surprised me, identifying issues related to confidentiality in terms of keeping to yourself what a patient may have told you, as opposed to sharing it with other members of the healthcare team. This is a conversation we may have more time to discuss in class. It actually surprised me, though, that individuals, health professionals, would agree to keep something confidential, that is, keep it hidden from other members of the healthcare team. I'd have to think about that for a while. Security is what the information tools that you use should be providing to deliver the level of confidentiality you have agreed to. And we heard some concerns this week that were raised about an information system change that might actually expose more patient data internally. And also lots of discussion on the board this week about the way in which the information tools that individuals have actually can be misused, maybe not necessarily in an inappropriate way, but in a way that's certainly questionable. Now, we sometimes think of these issues as ethical or moral issues when in fact they really are related to just basic practice issues. But I want to bring to your attention an explicit description of what is ethics and what is morals. Ethics is simply a principled approach to reasoning that prescribes thinking and actions according to a set of principles. Morals, on the other hand, are social conventions about what is right and what is wrong. On page 6, you see a summary of 3 different ethical frameworks that trace the history of ethics over time. First, pre-modern, where then ethical immediacy was what was governed the practice of individuals. Subjective certainty, that is what I believe, my family, my religion, my traditions, drove what was termed ethical behavior. Modern, or as your text calls principalism, was an approach to ethical universalism, believing that there were objective certainties that should be applied to make ethical reasoning. And those principles or theories or laws include some things that are quite familiar to you: autonomy, non-malfeasance, beneficence, justice. Your text describes them also. We now move to a third type of ethical framework that's becoming more widely accepted now, and that's called ethical engagement. Ethical engagement refers to the inter-subject contingency, that is case-based ethics, or as Carol Gillian reported in her wonderful book on in a woman's voice, or in one's own voice, the idea that ethics arise from a relationship basis as opposed to a rights basis. In this case, ethics are constructed in the context of the situation. Now, all 3 of these frameworks are acceptable ethical frameworks for you to use, and you're going to be applying them in this class on Tuesday when we get together to talk. But I'm going to call your attention most importantly to the Code for Nurses with its interpretive statement. And proposition number 6 explicitly talks about the importance of nurses participating in healthcare environments that are establish the proper ethical and moral care practices. Now, it's important for you to keep those 2 separate. The code does allow for both moral behavior, that which a community deems as appropriate, as well as ethical behavior, a set of reasoning according to a set of principles. On slide 8, I showed you the abridged Modern Medical Library Association's Code of Ethics. I thought this would be useful for you to contrast the ethical code for nurses because it speaks more directly to a consumerism approach, a little bit different than our approach. Slide 9 depicts the ethical model that your text, McGonigal and Mastrian, recommend using as you're trying to analyze an ethical situation. So let's take a look at this model in a little bit more depth. The ethical model uses the acronym ETHICAL to identify steps that one should go through. E, examine the ethical dilemma. In all ethical dilemmas, there's a value conflict. In order for you to understand the values conflicts, you want to be looking at a particular framework, and we've been using the work system model to understand where is the ethical dilemma, whose practices need to be captured or need to be represented or need to be thought of in this ethical dilemma. Ethics has less to do with what is the right way to behave, that's kind of a moral question, and more to do with what is the proper way to reason about behavior. Not every situation that has right and wrong embedded in it should be elevated to the level of an ethical dilemma. The SEEPS model will help you understand who are the stakeholders, how should you think about this model. Next, thoroughly comprehend the alternative. Often in an ethical situation, we reduce the conversation to a right or wrong. That is, we believe this is the right way to behave and this is the wrong way to behave. And if you are going to behave in an ethical manner, then you should always behave in the right way. That's a little too simplistic, frankly. Next, hypothesize the ethical arguments. And that's where you go back to your framework that you're using. A postmodernism, a modern or principalism approach, or a pre-modern ethical immediacy all give you the framework that you use to reason about something. Now, it's important as you're working as a group to actually come to some agreement about which framework is going to be used to guide the ethical discussion. Next, investigate, compare, and evaluate alternatives. And your text does a nice job laying out what some of the ways to do that are. Choose an alternative, act, and then look at the situation and evaluate. Now, slide 10 shows you the work systems model. As you're applying the ethical model in a work situation, you need to consider who are the people involved? What is the organization? Where is the ethical dilemma occurring, including what kinds of time frame do you have to bring it into resolution? What tools and technologies can you use, including consultants? And finally, is there a way to understand and to examine how the task that you're trying to accomplish can be thought about from an ethical perspective? Slide 11 summarizes the ethical model again from your text, and slides 12 and 13 describe a case that we're going to be using in class that we'll be discussing this week. Paul is a 12-year-old. He has diabetes that is fairly well managed, although his sugars are getting a little out of control right now. You, as the case manager, are brought into the situation because his PDA, where he captures his blood sugars, is now alerting you to tell you that there's a problem. That is that there's the blood sugars are becoming out of their stable range and something needs to be done. You contact Paul and his parents and say, I want you to come in, and in the email you send maybe a few more comments than you would ordinarily send, just so you don't forget them. Well, the email gets waylaid and gets now sent out to an entire community. Paul and his parents are embarrassed, and more importantly than that, they are upset with you for having breached their confidentiality. Now, I want you to look at this from an ethical perspective. There are other ways you could also be looking at it, for example, legal or work practices, but we'll spend some time in class discussing what is the ethical dilemma and how do we address it. Now I'd like you to move to slide 14, to our last focus of the semester. Slide 14 identifies advocacy and public policy. As advanced practice nurses, your responsibilities are not only to provide care, but to take leadership in the providing of care. On slide 15, again, you see, drawing from the code for nurses, we have a basis for acting and health and public policy. As you're thinking about public policy and a nurse's role in it, I want you to begin to think about how you're going to complete your activity this week. Your activity this week advises that you should identify a policy initiative and write testimony or communicate with a public official about it. On slide 16, I have another mnemonic for you to use to think about this public policy issue. Remember that advanced practice nurses drives towards nursing informatics policy. And remember, fundamentally, this is for patients, not for advancing advanced practice nursing, not for preserving prescribing rights or ensuring proper payment, but rather for ensuring patient care. That's why in your project I have you focusing on the nursing quality, the national quality indicators as the evidence that your intervention in your scholarly project is working, because the goal of our interventions is to work towards policy. On slide 16, we'll review the drives for public policy related to nursing informatics. Remember, your assignment this week is to focus on a policy related to one of the terms that you've used, one of the concepts that you've worked on this semester related to informatics. You might get the policy bug and decide there's a lot of other public policy you want to engage in. Let's walk through these drivers for public policy. Determine the informatics issue is the first step. What is related to your practice and informatics that you need to make a commentary on? Research and gather evidence. We've been talking a lot about this. I know you know when a problem exists. You're trying to convince others that a problem is serious. In terms of researching and gathering evidence, you want to focus on the informatics component of the problem, not simply the care component. So, for example, is it a problem of access to information or rights to look at particular computer systems? Identify the target of your statement. Is it a public policy individual? Is it a legislator? Verify, get your information, understand also that person's readiness to hear. How do they like to hear information? What kind of content is appropriate to present? Enlist partners where possible, because policy is always collective action, and then submit your testimony. For class this week, you'll be simply submitting a summary. On slide 17, there's 3 different suggestions that I have for you about where you can make your voice heard. The Office of the National Coordinator of Health IT, the ANA and their Advanced Practice Nursing Statement, or the Wisconsin Nurses Association Policy Agenda. You may have others, but these 3 should get you started. I look forward to seeing you in class this week, and I look forward to a lively discussion. Have an absolutely wonderful day. Bye now.